Difference between deafness and hearing loss. Facts and figures. 466 million people worldwide suffer from disabling hearing loss, of which 34 million are children. It is estimated that by 2050, more than 900 million people, that is, 1 in 10, will suffer from disabling hearing loss. Hearing loss may be due to genetic causes, complications in childbirth, some infectious diseases, chronic ear infections, the use of certain drugs, exposure to excessive noise and aging. 60% of hearing loss in children is due to preventable causes. Neglected cases of hearing loss represent an annual global cost of $750 billion international dollars. Interventions to prevent, detect and treat hearing loss are inexpensive and can be very beneficial to stakeholders. The situation of people suffering from hearing loss is improved through early detection, the use of hearing aids, cochlear implants and other assistive devices, as well as the use of subtitles, learning sign language and other educational and social support measures. More than 5% of the world's population, 466 million people, suffers from disabling hearing loss, 432 million adults and 34 million children. It is estimated that by 2050 more than 900 million people, 1 in 10, will suffer from hearing loss. Approximately one-third of people over the age of 65 suffer from disabling hearing loss. The highest prevalence in this age group is found in South Asia, Asia-Pacific and Sub-Saharan Africa. Hearing loss and deafness. It is said that someone suffers from hearing loss when he is not able to hear as well as a person whose sense of hearing is normal, i.e. whose hearing threshold in both ears is equal to or greater than 25 decibels. Hearing loss is likely to be moderate, mild, profound or severe. It affects one or both ears and makes it difficult to hear loud conversation or sounds. Hard of hearing people are people whose hearing loss is between mild and severe. They usually communicate by word and can use hearing aids, cochlear implants and other devices, as well as subtitles. For people with more severe hearing loss, cochlear implants may be helpful. Deaf people often suffer from profound hearing loss, which means that they hear very little or nothing. They often communicate through sign language. Causes of hearing loss and deafness. The causes of deafness and hearing loss may be acquired or congenital. Congenital causes may determine hearing loss at birth or soon after. Hearing loss may be due to hereditary and non-hereditary factors or complications during pregnancy and childbirth, among them, maternal rubella, syphilis or other infections during pregnancy, low birth weight, birth asphyxia, lack of oxygen at the time of delivery, inappropriate use of certain medications such as aminoglycosides, cytotoxic medications, antimalarial, and diuretics, severe jaundice during the neonatal period, which can damage the auditory nerve of the newborn. Acquired causes may lead to hearing loss at any age. Some infectious diseases, such as meningitis, measles and mumps, chronic ear infection, the presence of fluid in the ear, otitis media, the use of certain medicines, such as those used to treat neonatal infections, malaria, drug-resistant tuberculosis and various types of cancer, trauma to the head or ears, exposure to excessive noise, for example in work environments where noisy machinery is used or explosions occur, exposure to very loud sounds during recreational activities, such as the use of personal audio devices at high volume for prolonged periods of time or in bars, discos, concerts and sporting events, aging, in particular, the degeneration of sensory cells, and obstruction of the auditory canal by cerumen or foreign bodies. In children, chronic otitis media is a common cause of hearing loss. Consequences of hearing loss. Functional consequence. One of the main consequences of hearing loss is the limitation of a person's ability to communicate with others. In children with unattended hearing loss, speech development is often delayed. Hearing loss and neglected ear diseases, including otitis media, can have very detrimental effects on children's school performance. Those affected tend to have higher rates of school failure and need more educational assistance. For an optimal learning experience, it is important that children have access to appropriate adjustments, which are not always available. Social and emotional consequences. Communication problems can have important effects on everyday life and can lead to feelings of loneliness, isolation and frustration, especially in older people with hearing loss. Prevention. In general, it can be assumed that half of all cases of hearing loss can be prevented through public health measures. In children under the age of 15, 60% of hearing loss is attributable to preventable causes. The proportion is higher in low and middle-income countries, 75%, than in high-income countries, 49%. In general, The preventable causes of hearing loss in children are infections such as mumps, measles, rubella, meningitis, cytomegalovirus infections and chronic otitis media, 31%, complications at birth such as birth asphyxia, low birth weight, prematurity and jaundice, 17%, use of ototoxic drugs in pregnant and lactating women, 4%, other causes, 8%. Some simple prevention strategies for hearing loss include, vaccinate children against childhood illnesses, particularly measles, meningitis, rubella and mumps. Give rubella vaccine to adolescents and women of childbearing age before they become pregnant. Preventing cytomegalovirus infections in pregnant women through proper hygiene, testing for and treating syphilis and other infections in pregnant women. Strengthen maternal and child health programs, including the promotion of safe deliveries. Follow good otological care practices. Reduce exposure to loud noise, both at work and in recreational activities, by raising public awareness of the risks involved. Enact and enforce appropriate legislation, and encourage the use of personal protective devices such as earplugs and hearing aids and headphones that muffle environmental noise. Testing children for otitis media and carrying out medical or surgical interventions if necessary. Avoid the use of certain medicines which may be harmful to hearing, unless prescribed and supervised by a doctor. Detection and treatment. Early detection and intervention are essential to minimize the consequences of hearing loss on a child's development and school performance. In infants and young children with hearing loss, early detection and treatment as part of neonatal hearing screening programs can improve the child's language and school performance. Deaf children should have the opportunity to learn sign language with their families.